I'd like to introduce Dr. John Sullivan from the United States, who prescribes LDN. Welcome, John.
Hello.
Could you tell me when you first heard of LDN?
About 10 or 11 years ago, I received a phone call from a doctor at a local research medical center he's a PhD doctor looking at the benefits of LDN, and he asked me if I would give it to a few patients on his behalf just to see how it does in the outside world. Mm-hmm. And that was my first introduction to the use of LDN. From there, the word got out that I was recommending LDN, Low Dose Naltrexone, and the patients themselves, by word of mouth, have been coming in and teaching me incredible amounts of insight.
And what were these patients that you first prescribed LDN for? What condition did they have?
Well, in the very beginning, it was mostly cancer patients, cancer of the lung, breast, and prostate. But very quickly, the patient population changed into autoimmune-type diseases, most frequently autoimmune neurological diseases such as MS, but also autoimmune rheumatoid arthritis and thyroiditis.
Mm-hmm. And what kind of a success rate have you been noticing?
The success rate is in the high 90s. I don't keep statistics to be able to give you an exact number, but it is so impressive that, in my professional opinion, LDN should be the drug of choice for these conditions. And most of the crab drugs for the neurological diseases are obsolete at this point.
And do you notice your patients experiencing any initial side effects?
Well, there are a few that I caution them about, but they are not universally experienced. Sometimes there's a loss of appetite and a secondary loss of weight. Sometimes there's interference with falling asleep, and then sometimes there is bizarre dream patterns that are new and different. So I caution them about that. Once in a blue moon, somebody will have abdominal discomfort, especially if they have the autoimmune bowel inflammatory diseases like Crohn's or ulcerative colitis. And for those people, we have developed a transdermal application of naltrexone.
So what do you advise for your patients when they come to see you to request a prescription of LDN?
Well, initially, we make sure that they understand the goals and the capabilities of naltrexone so that their expectations are not out of proportion or beyond realistic. We also go over their diet because diet is important to help the naltrexone to work better and to make sure that they don't have any conditions which will sabotage the naltrexone, namely intestinalized candida or systemic candida, which is actually fairly common out there in the general public. We then talk about how the dose is started. We typically start at a smaller dose and gradually build the patient up in order to get around some of these side effects that I mentioned earlier.
Mm-hmm. And how long would you advise a patient to stay on LDN if they were convinced it wasn't working for them?
I would give it a minimum of 6 months to make a decision about that. And the patients in whom it doesn't work are really, they are in the minority. They're very, very rare. And if it doesn't work, then it raises a question about, was the original diagnosis truly accurate?
How long have you, in your experience, does it take for LDN to work for people?
Depending upon the condition that you're treating, I've seen results in as little as 3 weeks and as long as 3 months. But the peak benefit may not arrive until the 4th or 5th month.
Mm-hmm. And people ask me about taking alcohol with LDN. What is your opinion on that?
I do talk with people about alcohol. It's part of the routine, LDN seems to magnify the hangover effect the next day. So I caution people to reduce the dose of alcohol, reduce their intake, and test the water to see how bad they feel the next day, and then make their own decision.
Is there any other advice that you would give to people?
Well, yes. LDN does reduce the effectiveness of narcotic-based pain relievers. So I tell people that in the event of a catastrophic change or trauma or anything else that would need narcotic, they would need to put the LDN aside until they've convalesced from whatever life experience they're having, and then resume the LDN when they don't need the narcotic-based pain relief anymore. We find that LDN seems to work a whole lot better if the patient is on a gluten-free diet. I think it's not the gluten itself as much as the gluten is just a pro-inflammatory, and we're trying hard to reduce the degree of inflammation, and that's just another step in that process. And then the third thing, in similar vein, is the use of alpha-lipoic acid to just generally reduce inflammation.
Is there anything else that you'd like to add?
About LDN? No. I think the rest would just be observations here in the office and my personal strong belief in the value of LDN over any of the other patented drugs at this point. I just hope that it spreads and it becomes more available to patients, because most of the patients call and they will say they know about LDN, but they have no local medical support. Their doctor either frowns upon it or begs off the question and won't touch it at all, won't even give the patients a chance. And that's a shame.
Certainly is. Let's hope that with this DVD we can make a change.
Yes. It would only be a change for the better. And actually, the cost of LDN is so cheap compared to a single dose of any of the crab drugs that there's no comparison.
Mm-hmm. Well, thank you very much for sharing your experience with us.
Oh, you're more than welcome.